Following is a quick little video to give an explanation of one of the questions that has been giving some difficulty to people with the practice quiz. In this diagram, this is another diagram, we can see we have two lumbar vertebrae, L4 and L5 specifically. And we can also see that we have a disc herniation, which is being represented over on the left-hand side of the diagram here. Now, because this is L4, the nerve that would be exiting at this point in time, you should identify now as being the L4 spinal nerve, because it's exiting immediately underneath the L4 vertebrae, and that's the nomenclature in this area of the spinal cord. What is important to notice, though, which is being represented in this diagram, is that this spinal nerve is exiting relatively high in the intervertebral foramen, and you probably notice this in lab too, that as these exit, they move out rather laterally, and basically when they slide through, it's very, very high up in that intervertebral foraminal space. When we look at the actual disc herniation itself, the herniation tends to occur in the inferior portion of the intervertebral space. So consequently, the majority of these herniations will actually miss the nerve exiting at that specific level. So when we see an L4, L5 disc herniation, it's not going to have an effect on the L4 spinal nerve. It will have an immediate direct effect on the L5 spinal nerve exiting one level below the site of the herniation. So that's why in the instance of an L4, L5 disc herniation, or any sort of herniation, the first nerve that's going to be affected by this herniation is typically going to be the one that is one level lower than the spinal nerve that's exiting at that point in time. It's not a universal rule. There's going to be situations where you'll get an exceptionally large herniation which might impinge, or just anatomical variations, but typically what is seen in a clinical setting is, in most instances when you do have this herniation, it's not the nerve coming out at that level that's affected. It is the nerve coming out one level down that's going to be directly affected by the herniation. Hope this helps you to be able to answer some of these questions directed towards this issue. Thank you.